We're very, very concerned about patients who have significant symptoms and are just trying to ride them out at home. We noticed even before COVID came to this region was that cardiologists were seeing less patients than they normally would. My biggest concern is they were seeing across the country that 40% of patients with major heart attacks were not coming into the hospital. We've seen some of that here, patients coming in days after their heart attack, much sicker than they normally would be. This is really putting yourself at risk. It's putting yourself at risk of a very bad outcome. So we strongly, strongly urge you to come if you're having symptoms. These are symptoms such as chest discomfort, pressure, tightness in the chest, shortness of breath, even fatigue and palpitations. While I realize this is a time of increased anxiety and fatigue and palpitations may just be that, it's still important to get in touch with your primary care provider, your cardiologist, or come to the emergency room if the symptoms warrant that.
Patients are worried about coming to the hospital. Everybody has heard about what's going on in New York City, where the emergency department in the hospital is simply overwhelmed. They don't have enough resources to take care of the people in front of them. And that's considered a hotbed where you could come in well and end up sick, and you could be a person on a ventilator in a few days or hours. This is what people worry about. Here at Robert Packer Hospital and in our Guthrie hospitals, we're prepared should that eventuality happen, but also that's not what's going on here. So we have the capacity to see patients and to take care of you, take care of your family and your loved ones, and we're happy to do so. Everybody who comes to the hospital now gets screened and evaluated to see if they're at high risk of coronavirus or COVID-19. And if they do, or if you have symptoms that make us think about it, then we're going to put a mask on you, we're going to ask you to wash your hands, we're going to have you come back into one of our rooms, and you're going to be in a room by yourself. We may ask you to work with us on an iPad or text for a couple of minutes so we can get a little bit of questions from you. What might also be scary for you is when we first come into the room, if on our checklist you're at high risk for COVID-19 or coronavirus, you may see us come in with a mask, a face shield, a big blue or yellow gown, or we may look very different than the doctors and nurses that you normally see. But that's out of an abundance of caution to make sure that we're all safe. After a patient, that room gets what we call a terminal clean, which is a very extensive cleaning process that involves cleaning everything up. It's also getting exposed to UV radiation afterwards to make sure that any virus particles that were in that room from that person are cleaned.
During this time, patients that need to come in for procedures at the Heart and Vascular Center, we're screening them before they come in. We're having them wear masks. We're asking their loved ones who bring them here to stay in the car. We're keeping in touch with them. So we don't want to expose anybody, our patients or our employees, to any undue risk. Our employees are closely monitored as well. We go through the same questions being asked of us each day. Temperatures are taken, masks are worn. We want to assure everybody that it's a very, very safe environment here.
People have said that they're worried about calling 911. Does 911 have the capacity to take care of me? Can they make sure that I'm safe? Can they make sure that they are also safe? And you should know that our local EMS agencies have worked with both us at the Guthrie level, but then also with the state and with their medical director. And these are wonderful, dedicated individuals on the front line who want to take care of you. They also have personal protective equipment, and they have a low threshold to make sure that you are safe and to make sure that they are protected as well.
Our goal here at Guthrie, as always, is to keep our patients safe, to keep our community safe, to keep our employees safe, and that's what we're continuing to do through this crisis.